For everyone.
Yeah, not too bad. Feels like the holidays.
Yeah, I'm kind of looking forward to it.
A little bit.
Thanks, Glenn.
Sure.
Now, here's Roxanne Stein.
A colonoscopy is an important diagnostic tool for detecting colon cancer, and it's suggested that everyone have one by the age of 50. Dr. Avraham Belazan of Boca Raton Regional Hospital joins us this afternoon to talk about minimally invasive surgery for colon cancer. Very important topic. Thank you so much for joining us. Let's back up a little bit and talk about colonoscopies before we get into the surgery. Who should have one? We mentioned the age of 50, but then who else is in this group that should think about having one perhaps even earlier?
Well, first of all, thank you so much for having me this afternoon. Like you said, colonoscopy, as a general guideline, 50 years old is a good age to start having colonoscopies. There are certain patient populations that should have colonoscopies earlier. People with family history of colon cancer or other colonic diseases should have them earlier, sometimes starting at the early age of 40.
Has the prep gotten any easier?
Sure. The prep is actually a lot easier than it used to be. There's a lot less liquid that the patient has to consume in order to clean themselves out. And there are a lot of oral preps that are available as well, which make the experience a lot more easy to tolerate.
Yeah, it is easier, but it isn't that bad to begin with, especially for a life-saving detection tool like the colonoscopy is.
Not at all. I mean, the benefits so far away the inconveniences, and it's important to realize that most of my patients wake up after the colonoscopy, don't even believe that it was done.
Well, I'm right there with you on that one. It is not a difficult procedure. Okay, laparoscopic surgery for colon cancer. How does that work, and is that done in conjunction with a colonoscopy?
No, it's not. And in the unfortunate event that a colonoscopy does detect something that needs to be removed, laparoscopic surgery offers an alternative to traditional surgery, which would normally require a large midline abdominal incision. Laparoscopic surgery offers an alternative with the same curative surgery and the same curative rate for colon cancer or other pathology in the colon, without the big incision, and with many benefits such as quicker recovery, less blood loss, and shorter hospital stay.
Let's just clear up something. I had a couple questions from people saying, well, I had polyps removed during my colonoscopy that were cancerous. I did not have laparoscopic surgery.
Most likely those polyps had some cancer cells in them, but they were completely removed colonoscopically, so you did not require surgery. But unfortunately, many times colonoscopy does detect things that need to be removed surgically, and that's where laparoscopic surgery comes in. Minimally invasive surgery is actually an alternative to the traditional open surgery for those patients.
And how do they differ?
And
besides the size of the incision?
Well, it's amazing, however, that the size of the incision makes all the difference in the world, because the actual surgery is pretty much the same. You're actually doing the same thing in the abdomen, but the size of the incision dictates the recovery time, the hospital stay, the blood loss, and the trauma that the body experiences.
So obviously there'd be less downtime after minimally invasive.
Less downtime. My patients go back to work a lot quicker, and they experience a lot less pain. Probably even more exciting is the research that I've done on laparoscopic surgery with my colleagues at Columbia University in New York City that has shown that there's actually an increased cure rate for cancer, perhaps, with laparoscopic surgery versus open surgery, and the less trauma that you're inflicting on the patient may have long-term oncologic benefits, so that the patients are cancer-free for a longer period of time.
Thank you so much for joining us and sharing all that information with us, Dr. Belazan. Dr. Belazan is sponsored by Boca Raton Regional Hospital, which also underwrites our Ask the Doctor segment. We're back with more in just a moment.